Hi, and welcome to our first segment of CYEGA Mental Health Services. I will be talking to key members of CYEGA to gain a little bit more feedback on how to navigate through this crazy time right now. I know when people hear mental health, the first thing you think of, oh my gosh, I'm crazy. What a taboo. No, I have experts on the line that's here to help you out and to answer all those questions that you may have during this time. First of all, I just wanted to thank everyone for coming, so sit back and enjoy the show. Now, the first person that I have up is Mr. Dave Williams. He's a licensed professional counselor. He's going to be giving us some insight on what does therapy look during this time? What does my sessions look like? Am I able to gain access to a therapist during this time? You know, Mr. David is going to be able to provide us all that information and provide all the questions or the answers to the questions you may have. Please join me in welcoming Mr. David Williams to the show.
Thank you, Brittany.
All right, we are happy to have you, Mr. David. Now, Mr. David, tell us about yourself. Do you have any family, or tell us a little bit about you?
Well, as Brittany introduced, my name is David Williams. I've worked in the field of mental health for over 45 years, experience in both direct care and administration. I was born in Texas and have lived here almost my whole life. I've been married to my wife for over 30 years, and I have two wonderful daughters who both have college degrees. I began my career in mental health, first starting here and then becoming employed as a psychiatric nursing assistant on the psychiatric ward right here in Houston, Texas at St. Joseph Hospital. I earned my Associate of Science degree, my bachelor's degree, and I have a master's degree in behavioral science. After obtaining my master's degree, I went back to college at the age of 54 and became a licensed professional counselor. Having a lot of experience in the mental health field was a great asset to me becoming an LPC, and I feel like that I'm more well-rounded care provider and I'm more effective in my role as doing intake assessments. I'm also the auditor for CYEGA Mental Health as well. I'm passionate about mental health, and it's something I enjoy doing. This is my life mission. CYEGA is licensed to perform mental health services in the state of Texas, and we work with clients from different socioeconomic backgrounds, different races, and some needing a lot of services and some needing less. Most of our clients come from hospital referrals. Perhaps the client begins to experience intense symptoms that cannot be managed without hospitalization. But once the client has been stabilized, they come to CYEGA for follow-up treatment. Unlike the hospital, we provide quality care in the home, which is an environment the client is more accustomed to, and we work toward addressing the goal of maintaining the client's stability. Coming from the hospital, the clients have already met with mental health professionals who have done an assessment, but I also use their information when I do mine. After the assessment, I work cooperatively with the parent and the client to develop individual treatment goals and objectives. At that point, they're assigned a case manager, the family, using the treatment plan as a guide to assist the client and parents with achieving their treatment goals.
Wow, that sounds awesome, Mr. Dave. Now, with that information that you provided, can you tell me a little bit about how services are being done remotely? If patients are in need of help due to COVID, can they see you via the phone or telehealth?
Yes, CYEGA is currently providing that service. We're not doing intakes in the office at this time due to the COVID-19 virus, but I do connect to the clients and the parents at their home. And I think that the assessment in the client's home is more convenient for the client and the family since they don't go in their car to the office. And this is especially important for people that live far away from the clinic.
That's
also,
true.
being in the home, it's a more comfortable environment for the client, and they're more likely to open up with important and relevant information. And most CYEGA staff are doing our part, not spreading the virus by maintaining social distancing.
Yes, that's good to hear, Mr. Dave. We are doing our part by making sure that our clients are safe, that our staff is safe. That's very good to hear. Now, what kind of, Mr. Dave, due to the pandemic, what are new diagnoses, or what's the most current diagnosis that you're seeing now? Are people more anxious or depressed?
Anxiety and depression are very common. Depression is considered to be the common cold of mental illness. We see a lot of children who are going through very difficult times in their life. Oftentimes have problems with anger and anger management, and we work with them on learning how to express their emotions in a healthy manner. What we do is we teach coping skills and symptom management techniques to help them learn how to express their emotions in a healthy manner. Many of our clients do not have this information. They don't know what they're feeling and they don't know how to express it. And consequently, they act out behaviorally what they're feeling. So
Wow.
it's up to mental health professionals to provide them with that information and assistance in learning how to express their emotions in a healthy manner. A
Wow.
typical client that we see is in need of high self-esteem, which is an inherent part of mental health. My career in the field of mental health, I've learned if you change the way you think, you can change the way you feel. Many clients come to us with negative thinking, which limits their ability to be successful. Irrational thinking and beliefs lead to mental distress. I
Mhm.
believe it's best to avoid thinking, eliminating words such as always, never, and everyone. Another useless word is the word should. You can throw that in the garbage. You don't need the word should in your life.
Wow.
Memorizing statements such as the most important thing to think, the most important thing is what you think about yourself, not what anyone else thinks about you. When stressed, take 3 deep breaths. Whenever I hear someone put themselves down or say something negative about themselves, I challenge them not to make depreciating self-statements. We can be our own best friend or our own worst enemy. Also, learning how to forgive oneself is a key component of the development of mental health.
Oh, wow.
So we work closely with our clients in learning how to express their emotions in a healthy manner. Assist them with raising their self-esteem by acknowledging their inherent self-worth. Once the
Wow.
client has learned how to express their emotions in a healthy manner and learning how to be assertive, it helps to assist with their mental health. Self-confidence and has learned the skills to articulate their feelings, it can be a liberating experience. These skills are
Wow.
not inherent but must be taught.
Wow. That's so encouraging to know, Mr. Dave. I know myself, the world has kind of flipped upside down and I'm forced to do work different, staying at home, working from home. Do you notice that a lot of parents are also frustrated just because the kids are home? Are you seeing some of that as well during your intakes?
Definitely. What I just talked with a parent yesterday who was telling me that having, at being at home with the family has increased stress. Uh,
Mm.
and I think that it's important to learn how to deal with that. Get out, enjoy yourself, go outside, smell the roses, and take some time away in a controlled environment. And be refreshed because staying inside the house every day is not good for anyone.
Yes, yes. And what would you say to people that are struggling that says, you know what? I have fear. I don't know what to do. How do I ask for help? What would you recommend to them?
Give us a call. Call CYEGA. We'll be glad to talk to you. We can make an appointment. You can come in, or
Virtually, that
we
is.
will connect with you.
Yes.
We will connect with you virtually, and we will discuss your life and your situation, and we'll do everything we can to help you.
Very good. Very good. Now, Mr. Dave, what about medication management? If you're doing an intake on a patient, do you also recommend medication if needed, or how does that work?
If they're already on medication, then what we're going to do is we're going to refer a psychiatrist or a nurse practitioner for a medication evaluation. You might not be on medication when you come to see us, and it's not a requirement, but at the same time, medication can be a real adjunct in therapy.
Okay.
It can be a greatest. A pill by itself is not going to cure you, but it can help you with your emotions and bring you to a point where you can begin to participate in psychotherapy and address the issues that.
Okay. Now, let me just do a check-in. Mr. Dave, are you still there?
Yes, I'm here.
Okay, great, great. Now, Mr. Dave, in your
Can you hear me?
intake, yes, I can hear you. We're good. Now, in the intake process, you do an intake. Do you also recommend therapy, individual therapy if needed? And, tell me a little about like how therapy is being done. Are they seeing the therapist over the phone or through telehealth software? Is that something they should be nervous about?
No, not at all. What we want you to do as a client is to be comfortable and to be able to discuss your thoughts and feelings with a licensed professional. So we will connect with you through our teletherapy and discuss whatever issues are going on with you. So I urge anyone that is distressed and feeling like they need help, there is no shame in reaching out. Matter of fact, I say it's a strength that you
Wow.
recognize that you need help and you're willing to contact somebody to discuss what's going on in your life. We all get stuck every now and then. And
Yeah.
sometimes it seems that we have blinders on and we're not able to see the other alternatives that exist in the world. So that's why we, as therapists, that's what we do is we work to help see other options, see other choices in your
Mhm.
life, and recognize and take responsibility for what you're thinking and feeling and moving forward past whatever block or difficulty that's going on in your life.
Wow. So what I'm hearing is that you're giving them hope, and that's what this country needs. That's what this nation needs right now.
Without hope, it is a very difficult world.
Wow. I do agree with that, Mr. Dave. Thank you so much. Now we're going to be moving on to another segment. We're going to keep Mr. Dave there because we have some more questions for you, so don't go too far. But the next person we're going to be bringing up is our master lead, John Fernandez. John, are you there?
Yes, I'm here, Brittany. How you doing today?
Good. How are you, sir? Good to see you. I know it's been a while since we've been able to go to the office, so I'm so happy to see you via this software we got going on.
Yes, ma'am. Yes, ma'am.
How are you staying sane over there?
Trying to stay busy, keeping busy as I can. Family, different
Okay.
things. So busy.
Great, great. Tell us a little bit about yourself and your family.
Yes, ma'am. I'm originally from California. Moved to Texas in 2015, so I've been here about 5 years. 3 of those years I've been with CYEGA. Been a great experience being here. I have a wonderful wife, 3 wonderful kids that I love dearly. Real passionate about what I do, and I'm grateful for being a part of CYEGA. Get to be passionate what I do, give back to the community. But the best part is I get to be myself when I'm at work, which helps make an impact on these clients.
That's very good. That's very good. Tell us about your background in mental health. Do you have a degree in psychology, or how'd you get started in this, or wanting to be a case manager? It's a difficult job.
Yes, ma'am, it is. There's a lot of different things we could be doing. Like I said, passionate about this. A degree in sociology with an option in social work. Ever since I was a kid, I've been working with kids, whether it was coaching. I did ABA past, worked at an ABA school, worked at continuation school, and through those I've done case management, worked at other case management entities as well. But CYEGA's been home, and I'm grateful here.
Oh, well, we're grateful to have you here, John. Now, what kind of patients do you work with? Do you work with kids or adults, a combination of both?
I work with both here at CYEGA. I'm the lead case manager, and within that entails that it's basically if clients are having a hard time, high risk clients, I'm the one that goes out and sees them. Um, also, I work different things with youth as far as putting them with different professional football players. I used to play football, so I'm in the community allowing people to help me help these clients as well.
Wow, that's definitely what's needed, especially in different communities. What would you say to someone who felt like reaching out for mental health services means that they're crazy? What would you say to them?
It definitely doesn't mean that. It just means, you need help. Everyone here, everyone needs someone to talk to eventually in their life. A lot of us, believe it or not, we do what we do at this job because we needed someone to talk to once, and we want to give back and kind of give what we needed at once in our life.
That's very good. That's good. That's good. What are some of the things that if a patient needed your services, what are some of the things that you do during your sessions?
So I haven't been able to do it as much,
I
but I'm
know.
an active manager, so I like to take these clients out in the community. Like Dave mentioned earlier, being in the house is something that can cause depression. So I love to do a lot of community outings, whether it's going fishing or exercise, walking the neighborhood, just getting these clients out the house and giving them that energy, that positive energy, and being outside the house, building confidence and taking away from the setting that may be causing that depression is definitely big for these clients.
That's very good. Tell me a little bit about the kids that you're working with right now. Are they anxious? Are they seeing some depression? What's going on with our kiddos in this time of COVID?
A lot of boredom. A lot of kids are telling me like, a lot of these kids are big on video games and stuff like that. And when they were in school or they were active outside, they look forward to coming home playing video games, and now it's something they're waking up to and something they're going sleep. They don't have as much to look forward to, so we're definitely being affected by this COVID-19, and it's definitely putting our clients in a situation. But hopefully, we'll come out of it soon and we can get back to normal.
Very good, very good. That's good to hear, John. I know the patients that you work with are very blessed to have you. And one of the things I hear about you is how amazing your clients love you, how much of a breakthrough you're making. And that's what really we're here for, is for the patients and to make sure that we are making that change. So that's good to hear that. Do you also work with adults or a little combination of both?
Yes, I definitely work with adults as well. You working with kids and working with adults is a little bit different. So with
Yeah.
the kids, like I said, the one active and play sports like that. I still currently play football, so I have access to a lot of celebrity athletes. One here locally in Houston that kind of works with the kids from my kids and stuff like that. Just to give them something to look forward to. As far as adults, we do different things, whether just going walking, go within the house, doing different things to give them that energy. So working with kids and adults is definitely different, but it's something
Yeah.
here at CYEGA that we do, and we get, like I said earlier, we get to be ourselves, which makes it a big difference in the progress that these clients make.
Very good. It looks like it's that relatable thing that really draws your patients to you.
Definitely.
That they feel like, I'm not alone. This guy can relate to me. He looks like me. He's from where I'm from. So I think that's so much
Yes,
needed,
ma'am.
so having the comfortability of working with someone, because someone coming into your home, I think we can all agree, and you too, Dave, that could be a little scary. Who is this person coming in my house?
Yes, ma'am.
So that's good
No,
that you're.
that the report. Big.
Tell me a little bit about that. You said rapport building. What is that?
So basically, how basing your getting to know you, um, and you getting to know your client to make them feel comfortable enough to talk to you and trust you. Because without your client trusting you, they won't make progress. They have to be able to trust you to tell you, because if they're honest, that's how you can make a difference. Honest with you, how are you going to know exactly how they're feeling, exactly what they're going through, and how to help them get through that. So if they trust you, they're honest, it definitely makes a difference in how you can teach them the skills that we teach.
Very good, very good. Now, do most of your clients come from the psych wards, or do they come a little bit of a mix?
Definitely a little bit of a mix. We the hospitals. Actually, sometimes families see me working with kids or working with adults, and I'm kind of going through something similar. Do you have a business card? And they kind of out, which is definitely a good thing because, like we said, there's a lot of people don't want to reach out for the help because of the stigma. Oh, if I'm crazy. But like I said, when they see you when people see you working with somebody, and like I said earlier, you're able to be yourself at CYEGA. So it definitely makes people feel more comfortable when they feel their somebody that's, like you said, definitely relatable.
Yeah, definitely, definitely. I mean, you definitely want someone that you understand and that understands you. And that's what I'm hearing that CYEGA provides. Thank you, Mr. John, for giving us a little bit of information. You stay close because we're coming back to you too. Thank you, John. Now, help me join in recognizing our lead case manager, Mr. Pedro Martinez. Hi, Pedro.
How's it going, everybody? Hello, Brittany.
Hello. Thank you so much for joining our panel discussion on, services, how CYEGA is conducting services remotely due to COVID. We are so happy to have you here. Tell us a little bit about yourself and your family and a little bit about you.
All right, thanks for having me. Well, a little bit about myself. I've been on the CYEGA team for a little bit over a year now. I'm super excited. I'm passionate about what I do. I've been doing mental health about 6, 7 years. Started off in the Air Force. I'm part of the Armed Forces. Currently, I'm reserved, but that allows me also to work here at CYEGA and take a lot of the experience that I learned from the military and schooling and apply it to what I love, and that's helping our clients.
Wow, that's good to hear. I'm sure that the kids love the fact that you've been in the military. Do they ever ask you questions about it or anything like that?
Of course, not just the kids, but the parents. They love the structure. It's good to share the stories. And even we have our veterans or family members of veterans, and that's always good to be able to, like John said, relate to our population to just build that rapport and trust.
That's very good, very good. Now, I heard a little birdie told me that you're also bilingual.
Of course. So
Yeah.
that's important too. We're based out of Houston. Currently, our office, so we have a population that's bilingual. A lot of our clients are Hispanic, so I'm able to utilize that skill set in translating or facilitating communication, whether it's for the parents or for the clients, the teachers, just in every avenue. So it helps.
That's very good. Tell me about mental health in different populations, such as the Hispanic population. Is this a new thing that with this population? Are they very receptive to the information? Tell me a little bit about how you use your in that community to bring mental awareness, because that's so important to bring mental awareness to all communities. So how are you bringing that to the Hispanic community in your service?
I think being Hispanic myself, it goes back to a cultural competence aspect. So I'm able to understand and relate to what the stigma surrounding it, whether it's cultural bias or just mental health bias. So just explaining to them and breaking down those barriers is I feel like it's part of my job as a case manager and as a lead, and just advocating mental health in general. So part of the stigma is your view as being weak. If you open up about your mental health, whether it's depression, whether it's dealing with anger, we like to use the word machismo in our Hispanic culture, and that's something that I kind of work on with the parents and the child. And it's not anything to be ashamed about or anything to look down on, whether it's looking down on your child or even a family member or a friend. That's part of just the advocating piece, but just being supportive. it's not so much new as far as mental health, but
Mhm.
how it's viewed can be new.
Can be.
Um, it was viewed, I feel like, for the longest in a negative light. I believe now we're getting to a point where it's starting to be viewed as helpful, or getting help isn't viewed in such a bad way.
Yes, I even noticed that this week. I don't know if you guys saw, but they were talking about Kanye West in the news and him struggling with bipolar. And I think as these celebrities are able to come forward and say, "Hey, I need help. Hey, I have mental health," then that does that. So they're able to say that it's okay to seek help from someone. So I definitely agree with you of making it more of a positive thing than a negative stigma.
Mhm.
Now, tell me a little bit, Pedro, as a case manager, how do you connect a therapist? How does that work here at CYEGA?
Okay, so I believe it's a twofold system, or that we have here in CYEGA. So we have our case management side, then we have our licensed therapist. So I look at it as a team concept. Me being in the Air Force, I like to use a lot of our Air Force analogies. So I call it the wingman concept. So it's not only are you getting case management service as a client, but you're also getting a licensed therapist to um, help as well. And we kind of work off each other. So you're getting a lot of support. So sometimes what I may have a question on, the therapist could give me the answer to, or guidance as far as to giving that client even more, or the proper training and the proper coping skills. So that's a great thing about it. I think it's kind of new because people that aren't used to working with the therapist, again, it goes back to the stigma, whereas you feel that you may, I don't like to use the word, well, people may say something's off, something's wrong with you. So we want to again break down that stigma and those barriers, and just make it, normalize it, basically, like case management and therapy. And by getting those, you're doing yourself a service and
Sorry.
your family, and it's a great thing. So having that dual team helps a lot.
That's very good, very good. I guess I would pose the question to you as well. What kind of diagnoses does CYEGA work with bipolar from ADHD? Is it like a range that you work with in regards to your client caseload?
Like you mentioned earlier, right now we're in the middle of a pandemic. So David touched on it briefly. COVID has a lot of folks dealing with anxiety. Even we're thinking ahead, post pandemic. God willing, we get over it soon. You're gonna have a lot of PTSD, and diagnoses are gonna come with their moral injury, with our nurses and with our staff on the front line that's treating our patients. But John mentioned it: depression, being stuck in the house with cabin fever, anxiety, ADHD, kids struggling with transitioning from being in a traditional classroom to virtual. So all those things kind of play a factor, whether they're diagnosed with a specific um, mental health condition. Now we're seeing areas where now we're going to have to do an assessment or reassessment,
Yes.
figure out what's going on and how we can alter our approach to helping the client.
That's very good, Mr. Pedro. Mr. Dave, Pedro mentioned an assessment. Would that be like a CANS or ASNA assessment? What kind of assessment would you guys use here at CYEGA to kind of help with those things that Pedro mentioned?
Basically, what we do is we do a psychosocial assessment of every client that comes in for service. And what I mean by that is that we have questions. We want to know your background, what you've experienced. If you're on any medicine, we need to know that as well. Even if you're not on medicine, that's so. basically what we do is we ask a lot of questions, and we do a lot of listening too, which I think is a key component in what the services we provide. We want to hear what you have to say. We want to hear whatever you've experienced, and then after we get that information, we'll begin to work with you on whatever barriers or difficulties or challenges that are presenting to you in your life.
Very good. Very good. It sounds like here at CYEGA, there's a plan. And that's what I like hearing, because when clients come in, they already have been traumatized, either that something brought them into the psychiatric hospital or facility. So hearing that you guys at CYEGA have a plan, that's good to hear. John, if I could bring it to you, what would you say to a client that says, I'm ready to give up, there's no hope? What would you say to those out there who are looking at this video and saying, I'm about to give up?
Don't. Because there's a lot of life for everyone here to live. We all have something to look forward to, and that's definitely what we give here at CYEGA. Give these clients something to look forward to. Case management services and the therapy we provide, like Pedro said, it's a team concept, and definitely I feel these clients, and they've even told me, look forward to what's coming. So keep fighting through, and know have our support. Like I tell my clients when I leave for session, anything, call me. My line's open 24/7. In that sense of comfort, so they don't have to feel that way.
Yes, it's good to feel that they can always have access to you when they need you. That's good to hear. Good to hear. Now, Pedro, can you explain a little bit about the medication management piece, kind of like what Dave was touching on? As a case manager, do you guys help scheduling, or how do you get the patient to medication with CYEGA?
That's a really good question, Brittany. So for medication is an important piece to the case management side, because we have to make sure that not only are they taking the medication, but they understand that what they're taking and the reason they're taking it. So whether it's an adolescent, an adult, you have to kind of just make sure the accountability piece is there, and that they understand the reason why and when to take it. So a lot of times, again, we'll have to develop a plan with the client, whether it's labeling the medication, whether it's knowing when to pick up their medication. So there's a big communication piece to it as well, as far as just, again, knowing the pharmacy, knowing when to pick it up, when to take it, and again, make sure you're eating when you take the medication, you're hydrating properly. All those factor in.
Wow, it's good to hear. It seems like it's a lot of things, and what I'm hearing from you gentlemen is that here at CYEGA, it's more of a wraparound approach, where it's combining the medication with the therapy, with the case management, and bringing those services to the front.
Yes, ma'am. A multidisciplinary team approach, and if we kind of keep it in that perspective, then even if one area we know that's kind of needing help, we're a support system for each other and the clients.
That's very good. I like what you said, support system. I guess I'll start with Mr. Dave. Mr. Dave, how are you staying sane? I know it's kind of hard as a therapist. You're hearing other people's concerns. What are you doing out there to stay mentally sound, during COVID this time?
I have found a great asset to maintain your mental health is humor. So I do get on YouTube, like many of our clients do, and I find something that I consider humorous that makes me, and there's a saying, laughter is the best medicine. And it is true. There have been research studies to show that our bodies function better physiologically when we're laughing and when we're in a good. So humor is an integral part of mental health. So I love jokes. I'll go ahead and tell you one since you asked.
Yes, I'm ready for this.
How many psychologists does it take to change a light bulb? One, but the light bulb has to really want to change.
Wow. Now that's very true, especially with mental health. You gotta want to put the work in.
You can't laugh at yourself. We need start. Okay. Sometimes I walk in a room and I think, why did I walk in here? And I think, oh, wait a minute.
Very good. That's good.
So yeah. Don't take it too serious. Oh, I heard this at a lecture one time. I went to a lecture by a psychologist, and he was talking about humor, which is a very unusual lecture from a psychologist. Most of the time, they're talking about what's wrong with you. But what he said was this, and I never forget: life is too important to be taken seriously.
Wow.
And I thought that was just a wonderful statement. So I etched it in my brain. I want to remember that. Life is too important to be taken seriously. And I thought he was the one that said it. But when after the internet came into existence, I Googled it, and it was Oscar Wilde, who is an author. He's the one that's quoted as the originator of the statement. But yes, I do believe that, and I embrace that idea that life is to be taken seriously. So, when you think that things can't get any worse, look, let's just try to lighten up and don't take it too serious. We're going to get past this. We're going to this too will. So inject humor in your life. I highly recommend it.
Yes, I love that, Mr. Dave. I'm definitely going to take that away. Life is too short to take seriously. Mr. John.
Too important. Life is too important to be taken seriously.
Yes, because time is here today and gone tomorrow. Very good. Thank you, Mr. Dave. Mr.
You're
John.
welcome.
Yes, thank you. Mr. John, what would you say? How are you staying sane and safe and making sure that you're prepared and ready to handle all these patients coming your way?
I'm finding new ways to keep myself occupied. To believe it or not, I just recently picked up golf, so the golf course is still open, and you can actually practice social at the golf course, right?
Yeah,
so I picked that up, Yeah. So I've been doing that here and there to keep myself occupied. Also, just being with my family is always fun. We love to be together. That's how I'm keeping myself occupied.
That's good. And you are still seeing the patients via the, I guess, phone or telehealth software. Is that correct? Or
definitely doing that. But during this time, this is a scary time for the world, not just for us individually. Like we said earlier, I'm the lead case manager, the master lead. So if a case manager has an issue, they're not able to reach a client during this time, it's very important. We are very passionate about what we do here at CYEGA. We will make that trip to ensure our client safety and what's going on. Obviously, during this, taking the cautious approach during this COVID, social distancing, wearing a mask and stuff. But we definitely don't want clients not answering the phone for days at a time. We want to go ahead and ensure their safety. We definitely here at CYEGA take like Dave said earlier, he does the intakes and all. And Dave has worked close with a lot of us, so he knows with these clients exactly, this client will make progress with this case manager, or this client will make progress with this case manager. And luckily, Pedro and I are both leads, but we'll, still do the work of a case manager as well. So it's definitely a blessing to be what I would say team captains for case managers.
That's awesome. That's awesome. Thank you, Mr. John. And Mr. Pedro, last but not least, I would pose that question to you. How are you staying safe mentally during this time and making sure that you're ready and amped to help these patients that need your help?
That's a great question. Well, you have to be resilient through these times. That's probably the best way I could describe it. And you have to de-stress. So part of that, like I don't have a family or kids like Mr. John or Mr. Dave. So I have a dog. So that's one of the recommendations. I I kind of push for our clients. I'm like, now that you're home a lot more, maybe have you considered a pet? Now you can social distance by walking with the pet. So that's a thing a lot of our clients have taken up is having a pet like myself, and we talk about having pets, and it just helps. Definitely a big support emotionally and even physically. You can go on runs with your dog or
That's very good. So that's part of the case management services is if they were working with CYEGA, that would be something that they can kind of get as part of the program. Is that correct? To assist us with that. If, of course, the patient's parents approved.
So, of course, safety first. We want to make sure they're not allergic to the animal or the pet. And two, that the parent has to approve and where they live as well. So we look at the intangibles that go with it, but we're looking in the benefits. We push for the benefits as well. So having that support, and then what goes with that is making sure they're mature enough to take care of the pet. And so we build a plan to go with it. So it always goes back to a plan.
Yes, very good. And when you say plan, are those some of the goals that Mr. Dave would identify in the treatment plan intake process? Are the patients involved, Mr. Dave, on those goals that they have?
We would. Yes. What we must do is work cooperatively with the client to develop treatment goals and objectives and interventions. We cannot do this independently from working with the client. It must become a part of the process that we use to develop the goals, and that way they're going to be more meaningful, and we want to make sure that they are achievable.
Okay. And a goal, for example, can you give us an example of a goal that you would identify during a visit or a session?
Of course. One of the most, as I said earlier, depression is considered the common cold and mental illness. So one of our goals is that we want to reduce depression. We want to reduce it by the frequency. Sometimes people come to us and I'll ask them, well, how often are you depressed? Would you say 1 to 2 days a week, 2 to 3, 3 to 4, 4 to 5 every day? So if it's every day, or even it might even be less. Our goal is to reduce it. And we're going to work on reducing that by helping you learn coping skills and symptom management techniques. One of the that's going to help you, and John can attest to this, is exercise. It has already been shown clinically, and research studies have shown that exercise helps to combat depression. So our goal, one of the goals on your treatment plan will be to reduce depression.
Wow. I didn't even know that. That's so interesting to know. John, I guess, do you use that as part of your case management services with the kids? John? Uh-oh. Test. Do we have John?
Yes, I'm here.
Okay, great. Is exercise, Mr. Dave was mentioning exercise, and he referenced you. Do you do that in some of your sessions? It sounds exciting and very interesting.
Definitely. That's my strong suit, Be great at what you're good at. Like I said earlier, I currently still play football, so I'm definitely active. Like I said, I've taken clients to work out a professional athlete before, so that's something they definitely look forward to. Do my session during the week. If I'm playing on the week, they come to the boy. Just something to give them something to look forward to, and just moving around, and it just makes them smile, and releases stress, releases depression, releases anger. It definitely does a lot for your mind and your body. So I'm definitely big on exercise.
Wow.
During sessions.
That's interesting. Very good. Very good. Well, I think that's most of the questions that I have today. I wanted to just get any leaving remarks just before we conclude the session. Pedro, Dave, John, any last remarks to give to patients just to close it out?
I'll start off. I always usually like to end my sessions with our clients with a quote or something. But one of the things you mentioned earlier, we want to eliminate that stigma, but we also want to be empathetic and keep our clients to where they feel comfortable with our process and working with us. So one of the things I always tell our clients is like, don't stop the fight. And basically, the minute you stop fighting is the minute that the enemy wins. So that means that enemy can be a variety of things, whether it's your depression, your negative thoughts, your thinking, things from the past. So we just want to let them know that we're here as a team, the multidisciplinary team, and comes out. And that was my piece. I'll let John and Dave go.
Very good, Pedro. Dave?
I would like to remind everyone, this is what I have learned in my life and my experience as a professional. Excuse me. If you change the way you think, you can change the way you feel. I think that it's very important to have good self-esteem. Accept yourself as you are, not for the way you think you should be or not for the way you want to be, the way you are right now. Okay. Yeah. And also, I think it's extremely important for us to forgive ourselves. We need to forgive ourselves for whatever sins, mistakes, all of our past, all made mistakes. Guess what? We're human, and humans make mistakes. Okay. We're not perfect. If we were perfect, we would be robots, but they're not even perfect because they're made by humans. Okay. Yeah. So accept yourself as you are and learn how to forgive yourself. And I'd like to end with a joke. I tried to eat a clock one time, but it was very time consuming.
I love those jokes, Mr. Dave. You keep them coming. You keep them coming.
I had to laugh at that one.
Oh my gosh. Even John said he had to laugh at that one. That was a good one. Okay.
Laughter is the best medicine.
Laughter. Yes, laughter is good for the heart. Good medicine.
It's John, very much so. An integral part of good mental health. Yes. Find something that you think is humorous, integrate it into your life. I can't laugh enough.
I'm going to actually take that in my personal life. I definitely think I need to laugh a little bit more. So I'm going to take that. That's going to be a goal for this week. John.
Very good, Brittany.
Yes. John, to close us out, final recommendations.
Like I said in my sessions, I'm here for you. My line is open 24/7. And here at CYEGA, we're here for you. So give us a call if you need some help. We're definitely here for you. And we're very passionate about what we do. So feel free to give us a call.
Awesome. Well, thank you, gentlemen, for joining our first segment. This is the first of many. Thank you so much for taking your time out, letting us know more about CYEGA and what services they offer. You guys be safe. Don't forget to mask up, and we'll see you next time. Till then.